My name is Shant Shekherdimian. I am a pediatric surgeon by clinical background, also have a master's in public health, and the issue of redefining Armenia-Diaspora collaboration and improving and sort of maximizing the potential of the diaspora in healthcare engagement is something that's been that I've been very interested and passionate about. And so today's topic will be just that. I have nothing to disclose in terms of interests or conflicts of interests for making this presentation. And I thought I would start by outlining the objectives. The talk I think, is going to be rather short. And I apologize in that there is not too much in the way of sort of innovative ideas, or a lot of scientific content. What I wanted to do is to sort of just bring up this issue, put it in a context or framework that at least works for me in my mind when I think about it, and then you hopefully use that as a starting point for discussions. As we all know, 2020 was a pretty dramatic year, and because of all of the events, there is definitely an increase in diaspora engagement, and for our topic today, that's also the case for involvement in the healthcare field. So I think it would be nice to look at diaspora engagement through the magnified lens of 2020, because I think that it's a good opportunity, and it highlights a lot of both the strengths and the weaknesses in diaspora engagement. But those strengths and weaknesses are pretty much aligned with a lot of what's happened over the past 2 or 3 decades anyways. And so even as we discuss specifically what happened in 2020, I think it gives us a lot of insight as to historically what has been happening and what the tendencies and what the trends have been. And then I think a lot of us have been talking about the issue of a potential lack of optimization of this relationship, and we've been bringing this up. But one of the things that we have not done specifically is hone things down and define what can be the main problem in Armenia-Diaspora collaboration, and sort of thematically, if we can simplify things and bring it down to a single way of looking at it, a single issue that we can put our finger on, potentially I would hope that that would be helpful in reorganization and reoptimization of things. And then again, the other thing that we have not done too well, at least in my mind, or what I have not done too well, is we've sounded an alarm. We've said that there is a lot of inefficiencies, a lot of issues in Armenia-Diaspora engagement, but we haven't proposed a way of fixing the problem. And I hope to do just a little bit of that, or at least propose a framework for restructuring the collaboration. Again, leaving a lot of room for discussion, because I am not sure, and I'm not an expert in how to do this, but I do have some ideas. Where are we, and where do we go from here? And as mentioned earlier, 2020 was a very dramatic year for us, Armenians, both in Armenia and in the diaspora. There was a lot that happened. And afterwards, there has been a lot of analyses, self-reflection, and calls for reforms within all spheres of our Armenian reality. A lot of this has focused on calls for assessments and changes within Armenia, but much of this can also be extrapolated towards organizations and activities within the diaspora. If we put aside some of the more sort of speculative or political commentaries, of which there is a lot out there, there's some terms or references that have been used to describe the state of affairs in many of the sectors in Armenia. And some have also used these to, or extrapolated this and used this in describing health systems as well. And you can see here, I've listed some of these that we see in commentaries or analyses, in that there has been a total system failure or collapse of systems in Armenia. There is preponderance of lack of expertise within various government bodies or ministries. We have not done a good job of having a vision, planning, and having a good strategy in the various sectors. And we've been content with just keeping a status quo or having a culture of average results. And all of these have led to our failures or our shortcomings over the past year or so. Even if we don't go that far, and even if we don't accept those criticisms, I think one thing that we can agree upon is that there is little doubt that given our resources collectively, both in the diaspora and Armenia, and 30 years of an opportunity to work our way up, we could have had a much more efficient and effective healthcare system, which obviously would have resulted in a healthier and happier population. And however we break this down, the diaspora has a role in that. And if we agree that we could have been at a better place, then I would propose that we should also agree that the diaspora could have been a much more effective contributor to achieving the desired results. That's not to say that we haven't had results, and that's not to say that Armenia's healthcare system is not at a better place because of the diaspora engagement. But again, it's mentioning that we could have done more and that we could still do more if we are able to optimize this potential resource. And I just brought, I leave a reference down here to start thinking about the types of things that we probably do not have enough of. We don't have enough of these success stories or case reports that show, and this specific example of how Ethiopia achieved Millennium Development Goal number 4, a healthcare-related MDG, was very much dependent on external assistance and collaboration. But we don't have too many of these types of wins or success stories with the diaspora as an external partner helping Armenia achieve many of these major healthcare milestones that have been developed or that have been set for low to middle income countries throughout the world over the past 15, 20, 30 years. And if we think about it on a more global level, I'm sure many of the participants of today's call, if not, or presentation, if not all of them, are healthcare related, but this isn't only about healthcare. When we recognize that we collectively are much more of in an existential crisis right now, we also need to understand that the need for and the role of a healthier population is not just about having a healthier population, but it's about a national security issue. It's about the safety and the prosperity of us as a people. And there is plenty of evidence for this in the literature, with a strong correlation between health and demographic outcomes, equality, and economic productivity. So again, this isn't only about reaching a healthy population. It's primarily for that, but it has bigger consequences as well for our future as a people. So 2020, and when I say 2020, the major events that we talk about naturally are the pandemic and the war in the fall, which the pandemic at least extended is currently still an ongoing issue. But we'll talk about these two primary events and try to dissect down and see what we did and how we did. If we start off with what we did, certainly there was a tremendous increase in the amount of diaspora engagement within the healthcare sector as it pertains to these two events. There was a lot of fundraising. There was a lot of management of these conditions or situations. There was definitely an increase despite the limitations that the pandemic caused. of actual, participation in medical care or doctors traveling to Armenia and Artsakh for both the pandemic as well as the war. And one of the interesting things that we all noted and should definitely be recognized and acknowledged is a significant increase in the engagement of our colleagues, our medical colleagues from Russia and the former Soviet space, particularly during the Artsakh War, was very, very noticeable to all of us on the ground. And that's a interesting, promising, and good development, I would say, because there's a tremendous potential and a resource there. And it was great getting to know some of our colleagues and getting to work with them. They also bring a very different and unique perspective with their background and their affiliations with the Russian healthcare system. I would also say in general that we did start to see some new modes of engagement, perhaps not new modes, but increasing use of different types of engagement that go beyond fundraising, beyond allocation and delivery of supplies. There was, because of the pandemic, because a lot of things went on Zoom, there were some advantages that we saw over there, and there was sort of an increase in telemedicine, teleeducation, and as we'll talk about later, even beyond that, there were some systematic changes that happened within how the diaspora collaborated amongst itself, how the diaspora collaborated with local entities such as the Ministry of Health. And I think those are all positive developments. But if we take things sort of more globally and we think about things in terms of large responses and large outcomes, I think that I'll come back later to this bucket with the leaks in it. But I think if we talk about what we did, there was a lot of what we did, and there was certainly a lot more of what we did. However, if we talk about our results, I'm not sure that our results equated to or directly correlated to the increase in the response or the increase in the activity of what we did. And I think the reason for that is going to be within this leaky bucket, and I'll go into this a little later. I think the issue is that regardless of the increase or the amount more that we did over the past year, we had not set ourselves up to have an amount of response that correlated with that increase in activity. So the 80-20 rule, I think, applies here pretty well. It's called the Pareto principle, and it states that usually for many things, 20% of what we do or 20% of time expended on an activity ends up yielding 80% of the results. And to reciprocate that, 80% of what we do oftentimes is not as high yield and only has a small impact on ultimate results at the end of the day. And this principle has been used in economics, in business, in mathematics, in a lot of the social sciences. And there's a couple of examples here of our day-to-day activities or things that we notice that follow the Pareto principle. As an example, most 80% of the time we wear only a small portion of things in our closet, or if we notice our kids playing, they have a lot of toys, but most of the time they're only playing with the one or two things that they end up using the most. So how does this sort of pertain to healthcare and specifically the diaspora engagement? What we did a lot of service delivery, but I would classify that service delivery as within this 80%. We did a lot more of this, but ultimately, if we measured results and if we measured outcomes, we probably did not have that much of an impact. We still fell within this 20%. What we have not done over the past 3 decades, and again, last year was sort of a magnified or it increased a lot of what we always do. So what we have not done in terms of creating sustainable development models is what could have had a lot more impact on outcomes and the results, at least with regards to healthcare, as they pertain to both the pandemic and the war, and as they pertain to healthcare. And so how do we think, if we think about this conceptually, and if we agree that, or if we can just imagine that healthcare is this bucket, and in our case, and in every healthcare system's case, there are leaks, there are inefficiencies, and there are holes. I would say that we spent a lot of time filling this bucket up with water. We did a lot more of that over the past 20 years, but we spent very little time in trying to plug these holes, which in my mind would have yielded, or would yield, a lot more of the results. It would have been the 20% of the effort, but it would have had 80% of the results. And so in order to sort of follow along with that idea, I think we should at least have a discussion and define what we mean as our results. This 80-20 rule, or the way I conceptualize it, would only apply if we agree that the results of effective diaspora engagement is a stronger healthcare system and improved healthcare outcomes. I suppose we can say that that should not be the results of diaspora engagement in healthcare in Armenia, and we can assume that the results, the desired results for the diaspora engagement, will remain in the humanitarian relief end of the spectrum of engagement, in which case I would have to retract everything I said about the 80-20 rule and say that we are pretty good with being a humanitarian relief responder. And when the time comes, as it did last year, we were able to step up and we were able to provide a lot of that relief. But I think that, and I hope that I would be able to successfully argue that that should not be our desired result, that ultimately we should recognize that the diaspora engagement should lead to a better healthcare system that's a lot more sustainable. And we should be striving for a system that can completely be non-reliant on outside engagement or diaspora engagement. And this is really how other people look at it too. This is not specific for just our Armenian reality. Even if we look at this Institute of Migration paper that recently came out that assessed the diaspora response throughout many, many countries. Unfortunately, Armenia was not included in this report. They looked at it, they assessed it, and at the end, they came up with best practices. And you can see here that the results were not aimed, or the best practices were not aimed, at increasing any type of sort of humanitarian work. But if we read here, what the best practices that were identified were talked about creating long-term sustainable networks with local actors, whereas and included diaspora organizations being involved in coordinating bodies and cooperation framework. And despite the fact that the pandemic was an acute emergency, an acute issue, the importance of developing and maintaining longer-term perspective, even in that emergency situation, was highlighted as an important best practice when diasporas were engaged in the pandemic in many other countries. So again, to me, this graph is, or chart is, or illustration is an extremely useful one in trying to understand where we are and where we should be with regards to diaspora engagement in healthcare. It comes out of a paper that talked about external stakeholders being engaged in improvement in fragile countries. And it talks about the spectrum that starts with humanitarian relief, which largely bypasses governments and is largely focused on service development, and then working our way up to sustainable development, which is all about strengthening local healthcare or local systems, and in our case, healthcare systems, and can only be done by effective government partnerships. And I would say, as I alluded to before, that to be fair, we have been marching up this spectrum in my mind, and maybe in others, maybe not at the rate or the level that we should be, and perhaps in terms of self-reflection over 30 years, we should have been much higher up on this arrow, but we have been going up. And I think over the past year, we have seen improved communications with the Ministry of Health. There's also been concurrently improved collaboration between the different diaspora segments throughout the pandemic, and particularly during the war. The umbrella organization that unites diaspora, various healthcare societies or professional societies within the diaspora, really stepped up, organized weekly online conferences within which there was representation from both the National Institute of Health in Armenia, the Ministry of Health, and this helped organizationally a lot. This helped many people within the diaspora know about the activities of our partners in all the rest of the world. It helped to consolidate some of the efforts with regards to, again, allocating or procuring supplies, knowing what is needed on the ground, making sure that we're following what needs to be followed in terms of the protocols of getting things there. There was a pretty successful effort in consolidating or helping to facilitate any healthcare providers who wanted to go to Armenia, making sure that they got there safely, making sure that all the documents were in order, making sure that logistical issues were addressed. As I mentioned earlier, both with regards to 2020 and again, to be fair, even before that, over the past 10, 15 years, we have been seeing many diasporan efforts to be involved in education and medical training. And some of these have started with sort of rudimentary efforts, which pertain to having very short courses, workshops, seminars, but even beyond that, we're starting to see certain engagement in diaspora in reforming or being involved with more global medical education transformation, in helping develop residency curriculums, for example, or primary care modules, going beyond just those short-term educational courses. And I think that's a positive development. Another example, or another thing that can be highlighted as a positive development over the past year, was that we're starting to notice that there is consolidative and some strategic planning that's been going on. And a case in point for this is the recognition that the shortage of oxygen during the pandemic was a major issue. And to the diaspora's credit and to the different organizations, there was an effort, sort of a multi-disciplinary, multi-pronged approach within which the diaspora was able to help with many of the tiers of or the challenges that were there with regards to the oxygen shortage, starting from very individual patient-centered sort of procurement and delivery of oxygen concentrators that a patient can take home with them, the establishment of an outpatient COVID management program, which allowed for patients to be safely sent home and free up hospital beds. The patients could be sent home with home oxygen devices, and then up to the level of obtaining and procuring oxygen generating machines at the hospital level, with which the diaspora collaborated with the Ministry of Health and was able to procure a number of these that were stationed at the COVID hospitals. And then more importantly, sort of an initiative that involved helping the Physics Institute in Armenia improve on and upgrade their capabilities to develop liquid oxygen, which again is probably the most sustainable way of the country having a long-term solution to the need for oxygen beyond, both for COVID as well as beyond in the future. And I think this sort of strategic, and I think this all came together because we did improve coordination, we did improve communication, both internally amongst the diaspora as well as the Ministry of Health, understood the needs, were able to analyze it and said, for the short term, we immediately need oxygen. We can immediately get these smaller devices for the patients. For the medium term, we can get the generators for the hospital. And for the longer term, we really need a solution so that we're never in this position again. And we're going to make the investment in the liquid oxygen production capability at the Physics Institute. And I think that's a good model and a success story with regards to the diaspora engagement. This talk, we don't want to go into sort of what are the challenges in healthcare in Armenia, but I think I just wanted to put up this slide that sort of goes over some of the whichever way we look at the challenges in healthcare in Armenia, whether it's organizational or sort of we look at it vertically, we recognize that there are issues with many of these foundational pillars of any healthcare system, or if we look at it sectorally within where the burden of disease lies. I don't want to go into any, much of this, but I only want to use this as sort of a template and ask the question as to how much of the activity and the engagement that we have with the diaspora addresses this or these types of issues versus how much of it is spent on things that, again, ultimately will not have much effect with regards to having sustainable outcomes. So again, going back to the 80-20 rule, these, in my mind, addressing these types of topics and these types of challenges, whichever way we look at it, are what's going to lead to 80% of the results or the outcomes that we desire. And so the question is, how much of the diaspora engagement actually addresses these challenges, which will have those bigger results, versus how much of what we are doing is in another bucket where we're doing a lot, but again, the outcomes and the results are likely not going to have a tremendous impact. And again, if we think about just sort of very generically categorize a lot of what the diaspora does and a lot of the diaspora engagement into helping with infrastructure and helping with access issues, we do have data that shows that that actually does not lead to better outcomes. This is a study that was done by Dr. Crook, who has also pioneered a lot of the quality studies that have happened in low to middle income countries. And basically it looked at the correlation between infrastructure investments and the observed quality of care. And the conclusions is that there's a very poor correlation between having investment in or improving the provision of infrastructure related activities. So healthcare workers in well-equipped facilities often can provide poor quality care, and the opposite. You can provide good quality of care, even if a facility is not the best equipped, is not the most modern, doesn't have the most high-tech equipment. And I think this is something that we frequently miss with regards to our inputs and our engagement as a diaspora in terms of what we are doing in Armenia. And again, this is another study that is probably well known to many in the Armenian public health world. It looked at some of the reasons and the barriers towards not seeking healthcare in Armenia. And you can see here the major problems. And I don't think these are a surprise to us, but the question we have, or I would pose here, is how much of the diaspora efforts, how much of the diaspora engagement actually addresses many of these problems. We can say that, for example, the provision of some equipment can help with improving diagnostic examinations, and some education and training can help with improving the qualities of or the quality of our human resources. But by and large, these have a relatively low impact on some of these perceived or some of these stated reasons for not seeking healthcare in Armenia. So coming back to the second objective, if we can put our finger on the main problem, I would propose that that we can state that the inability or the unwillingness, again, by and large, for the most part, there are certainly some clear exceptions to this rule, is that the diaspora is currently the way it stands, unable or unwilling to contribute point for a problem and start thinking about how that can change, I think we can have a big impact on the effectiveness of diaspora engagement. This is sort of how I conceptualize this. And for those who, I apologize, these are, I have sort of talked about this in the past. So for those who have heard this, my apologies. But this is something that my program director in residency had talked to all of us as residents in the past about, and has really left a mark in my mind, and is useful for me to conceptualize things. Before we started residency, he put up this graph, and he said that this is how your happiness and how your perceived effectiveness is going to fluctuate during residency. You're now here on day 0 or right before day 0. You're at your prime. You are the happiest, the proudest that you can be. You just graduated from medical school. You just got your white coat. You are, you feel very strong and capable. And then residency happens, and you start to work, and you start to realize how little you know, and you start to have some complications, and you start to realize, or what happens is that you can actually come down and hit a low, where your happiness and your perceived effectiveness is very, very low. And that's normal. It's okay for that to happen. But what you should strive to do is first recognize that that's going to happen, and then start to think about how you can improve your effectiveness and therefore your happiness throughout the rest of the time in residency. And that's what makes a successful training program. That's what makes a successful resident graduate from the program. If you're able to recover from this and then learn throughout the rest of your residency, then you'll come out a good surgeon, in my case. So can we think of a graph like this with regards to diaspora effectiveness over time? And if we start off with the post-independence period, where Armenia was recovering from huge economic catastrophe, there were major humanitarian crises, including the first Artsakh War and the collapse of the Soviet Union, and there were significant infrastructure and human resources issues. On the flip side, the diaspora was very excited and engaged in a newly independent Armenia. We had the resources to meet some of these human resources and infrastructure issues. And we had at that time a very well-organized and traditional diaspora structures that were able to respond. And so over the first decade or so after independence, I would say that we had a pretty effective diaspora engagement. The supply and the demand met well, and we were able to sort of step up and address some of the challenge, or at least help address some of the challenges in healthcare. But then Armenia went through a period of transition, and I would argue that the diaspora did not as much. As Armenia started to stabilize, the healthcare system started to stabilize and transition from a crisis management mode to having some breathing room and an opportunity to strengthen the systems. The diaspora started to become disappointed with some of the corruption and the bureaucracy that existed within Armenian healthcare system. Also, our traditional diaspora structures became a little bit more fragmented, became bypassed. Other stakeholders, other organizations started to come into the picture, which diluted out effectiveness. And most importantly, we didn't change the way in which we contributed or which we engaged in the healthcare system. Namely, we remained organizations that focused on either short-term medical trips to Armenia or provision of equipment. And therefore, our effectiveness over that decade or decade and a half started to drop precipitously. So, and that's where we are at now, more or less. Armenia has less needs in humanitarian care. Of course, the past year can be considered an exception to this rule, but we have more and more challenges in other issues such as governance and leadership in healthcare, the burden of disease, of non-communicable diseases, et cetera, et cetera. I think we're all very familiar with this. So we have a choice as a diaspora. We can continue to do what we do, but I would propose that our engagement and our effectiveness would be at quite a low level, or we can transform the way the diaspora engages in healthcare. We also, and so how do we do that? I think we need to, some of the things that are critical for that transformation is that we have to be willing to contribute to healthcare, to health system strengthening rather than focusing exclusively on humanitarian work. In order to do that, we need to be more, we need to focus on planning, we need to develop a vision and strategy, we need to focus on priority areas, and we need to have a plan in place, a strategy on how to get there, which involves proper assessments, priority setting, team building, and collaboration. Collaboration is something that's very important, both within the diaspora. The fragmentation leads to tremendous inefficiencies, as well as with our partners on the ground. I also think that it's important that we need to talk about, to be fair, we need to talk about the sort of ask, if you may, from the local leadership, local government in Armenia and the authorities in Armenia and Artsakh. We should have a better ask of the diaspora and a better defined role for diaspora engagement to serve as sort of a roadmap for us in terms of helping us decide what to do and how to do it. Traditionally, the approach has been, we will take what we can get. If there is a person or an organization that has this resource or this specialty, then come to Armenia. We would love to have you here. And that's okay, but I don't think that that gets us to where we want to be, which can only be which can only be achieved if we have a clear message to the diaspora on where the priorities are and how we can contribute to institution building and system strengthening in Armenia. I think one of the sort of success stories over the past year has been the program developed by the High Commissioner for Diaspora Affairs Office, namely the eGORDS program, which takes people with healthcare, in our case, although this is happening in many different sectors, with expertise in healthcare and public health, healthcare administration, et cetera, and actually embeds them within various state structures, which again, in our case, has been the Ministry of Health and the NCDC and NIH, et cetera, and starts to talk about and starts to contribute to the changes or the activities that lead to sort of sustained change within, in this case, governance and leadership within healthcare. And I think this is a program that has tremendous potential to have some transformative change using diaspora resources within the healthcare system in Armenia. The other issue that I think we don't touch upon enough is that as diaspora contributors to healthcare in Armenia, we actually operate under a complete lack of or near complete lack of accountability, which is different from any one of our partners in Armenia who is doing anything in healthcare. They are rightfully so under the scrutiny of the public in Armenia, media, regulation, authorities. However, in diaspora or much of the diaspora projects don't have that oversight and that accountability, which leads to questions as to how effective, sustainable, ethical even are some of the diaspora engagements. And I think that's an important question that we need to start to talk about, and we need to hold ourselves up to various standards and recognize that sometimes, not often, fortunately, some of the efforts that we have can actually lead to either direct or indirect negative consequences to the healthcare system in Armenia, what I've termed as collateral damages over here. So hopefully we can agree that there is benefit to transforming the diaspora engagement, diaspora input into Armenia's healthcare system from one that focuses on humanitarian support to going up that spectrum into developing or being a partner in sustainable development of capacity building or system strengthening, as it's called in Armenia. If we do agree on that, then we need to talk about how do we get there. And so I think that there are various key components. And again, I'm not an expert in sort of organizational development and developing of these roadmaps, but I have seen some of these in various aspects of our work at the university, at the academic medical center. And I wonder if we can use some of these components to think about more effective diaspora engagement in Armenia. I guess I can start off with talking a little bit about myself. I am a pediatric surgeon by clinical background. My day job is to operate on children. What I would love to do, what would be quote unquote dream for me in Armenia, is to do what I do well on my day job in Armenia. And I would love to come to Armenia and operate on small children and be able to to take part in the care of children in Armenia. But I've always asked myself as to whether or not that's the right way to engage in healthcare in Armenia. That's what is going to contribute to sustainable development, to capacity building in Armenia, or whether I need to take off that hat as a diasporan Armenian and contribute more to other processes that will develop stronger healthcare system, that will develop local capacity, and that will be a lot more sustainable. And I think, and what I've tried to do is do a lot more of the latter so that we can contribute to that system strengthening that I've pointed out so far. And one of my areas of interest has been in quality and improving the quality of healthcare and healthcare delivery in Armenia. Why quality? Because it's well known that providing health services without guaranteeing some sort of quality is ineffective, wasteful, and unethical in Armenia. And we know through this publication that came out a couple of years ago that actually that the burden of preventable deaths in Armenia, well, around the world, and definitely the case in Armenia, actually lies more in quality-related issues rather than barriers to or access to care issues. And again, this is sort of the worldwide split between access issues leading to deaths and poor quality issues leading to deaths. And this ratio definitely pans out in Armenia as well. And so I have been involved in some efforts to develop quality initiatives, quality policy and strategy in Armenia. And one of the things, one of the documents that I had come across and that's serving as a template in developing some of these is this toolkit from the World Health Organization that sort of breaks down the components of necessary elements of a successful national quality policy or a national quality program into having a policy strategy and having the necessary tools to do so. And so I wonder if we can use a similar template for developing a more effective diaspora engagement policy and strategy, if you will. In short, policy is where we want to be. What is our desired outcomes when we talk about diaspora engagement? What are the metrics of success? What is our vision for effective diaspora engagement in healthcare? And then can we talk about how to develop a strategy, which is how do we get there? How do we get to the point where we can look back and say the diaspora was really optimally engaged in healthcare in Armenia, and we have done the changes that are necessary to change the status quo in Armenia. So rather than looking at this illustration, which was meant to identify the key elements of developing a quality policy and strategy, I wonder if we can look at the same elements through the prism of the elements that are necessary to develop a national diaspora engagement policy or strategy. And so what are those elements and how can we think about that with regards to diaspora engagement? I think one of the things that we do need is an establishment and a clear communication of what the national health priorities are and where are the priority areas for diaspora engagement. So what are the what are the priority areas for the Ministry of Health or the government of Armenia, and then should the diaspora be involved in that, or should this be a primarily or exclusively something that the government or the Ministry of Health gets involved with, and then the diaspora is left to help with some of the remaining areas, so that there is a collaborative approach, whichever one of those approaches we end up choosing. It doesn't take away from the fact that without a clear delineation of the national health priorities, it's unlikely that we are going to have effective diaspora engagement, or for that matter, any stakeholder engagement, whether those are the international organizations or the banks. And again, this is absolutely nothing innovative or novel in what I'm stating. This has been stated many of times before, both in the Armenia example as well as other literature that has come out about effectively harnessing diasporas for the development of low to middle income countries. Having that goal and priority areas defined is a critical component of being able to engage external stakeholders, in this case the diaspora, more effectively. And in the interest of time, I'll just skip through that. There's also evidence for this. It's not just a conceptual thing. If we have health priorities, then we are able to inform the stakeholders, and they are able to be more effective in improving these challenges and finding solutions to the issues. The second key element here, again, this is for quality, but how can we translate this to diaspora engagement? What is the definition of diaspora engagement? What do we mean by this? I think we need to ask the question, all of us need to ask the question, both within Armenia and in the diaspora. Successful diaspora engagement in healthcare is defined as what? What do we want the diaspora to be involved with, and what do we not want them to be involved with? And I think that's an important starting point for getting optimization of the collaboration. Stakeholder mapping and engagement is pretty self-explanatory. I think we need to know who the key players are, who the key organizations are, what the structure is like within the diaspora, what the structure is like within Armenia. And only after having that clear map are we able to consolidate, to collaborate within the diaspora entities, and then to communicate with our partners on the ground. I think one of the things that we miss, and is a sort of huge shortcoming in the diaspora when we think about healthcare engagement, is that we focus primarily and almost exclusively on healthcare providers. And I'm not sure that is that will set us up for success, understanding that healthcare is a very, very complex sector, and healthcare providers are a key component of it. But I think that leaves a huge void with regards to the potential resources of the diaspora that can be brought in outside of the healthcare provider world, whether that be public health, whether that be healthcare administration, whether that be finance experts, legal and policy experts. These are the people that are going to have a critical say and a critical input in system strengthening and capacity building on a national level in Armenia. And this is a resource that we do have in the diaspora, but is underutilized and under-included in these discussions. When we look at our medical societies, when we look at our local groups of quote unquote healthcare people that come together, whether that be in Los Angeles or Boston, Europe, and Russia, 99% of the people that are engaged are physicians or nurses, and at best public health specialists. But we have not done a good job of identifying and engaging people that can also contribute to the development of the system as it pertains to the other sectors. Again, financing, quality experts, policy experts. We need to engage, map these people and organizations out and engage them in these discussions. Situational analysis is something that I've very, very primitively done in this discussion, but again, a more formal situational analysis of Armenia-Diaspora relationships and engagements in healthcare is one that we need to go through so that we identify where the gaps are. Again, coming back to this slide, if we do a situational analysis, how much of the efforts are addressed at or address these major challenges versus how much of them are in the periphery? The governance and the organizational structures certainly need to be looked at and then optimized. How is the which in theory should bring together all diaspora healthcare entities, but is there room to improve on that model? And then ultimately, where do we fit, and whether or not we fit within the organizational structure and governance of healthcare within Armenia? So can we, should we, and where can we have a presence or a seat on the table within the governance of healthcare in Armenia, or the Ministry of Health? And again, I see that I've been speaking too long, so let me go through this a little bit quicker. What are the improvement methods and interventions and the evidence-based examples that the Armenian diaspora can learn from and use as standards or templates for doing further work? And there are evidence-based examples from both within Armenia as well as precedent from elsewhere. If we look at the international literature, there are best practices, again, as they pertain to engagement of outside organizations or structures that have to do with coordination of resources, handling of fragmentation, inclusivity, and etc. And these can lead to more successful diaspora engagement. Again, there is literature on this. I don't think we need to reinvent the wheel. What about information and data systems? Do we need to have a registry of people that are involved from the diaspora? Will that help us better collaborate and be more effective? Do we need to have a database of different organizations or different initiatives that are active or that have been active? Do we need to have a website or some sort of access to resources so that people within the diaspora organizations that want to be engaged can go to that and learn about best practices, learn about how to do things more effectively? And do we need to have a platform for communication so that I can talk to my colleagues in Russia, in Europe, in South America, collaborate with them and be more effective in engaging in healthcare? And then this last element is sort of on the order of the accountability piece that I talked about earlier, which is the development of quality indicators and sort of core measures as they pertain to diaspora engagement. We should have metrics to assess our efficacy and how much of what we're doing is sustainable, whether or not what we're doing is scalable, whether or not there are any ethical issues or any issues with causing collateral damage in the initiatives or the types of engagements that we do. In essence, we need to figure out how the diaspora can transform and fit to the realities of the situation within healthcare in Armenia and be a much more effective engagement partner in Armenia. So I'll just come back to, again, in the interest of time, the three graphical descriptions that in my mind conceptualize where we are, what we want to be, which is, in my mind, we're largely in the realm of the bottom left of this arrow, and we want to be able to be climbing up more and more towards sustainable development or contributing to sustainable development of Armenia's healthcare system, which will then, which sort of conceptually, if we think about this, is more about plugging the holes of this leaky bucket of healthcare in Armenia. And if we are able to do that, then we are able to transform what we do into more within this 20% part of this graph, which will have a lot more results than where we are now, which is us doing a lot, but ultimately and effectively not having much results in terms of outcomes in healthcare in Armenia. Is this even possible? And there's a lot of skepticism out there, and there are some fair criticisms about this being too naive or being too idealistic, or having too much work to go through in developing this policy and strategy and identifying all the elements that I talked about. But in my mind, I think this is not the appropriate question to ask. We are currently under the state of existential threat, and we don't have the luxury of asking this question. We must have a healthy society. We must have an efficient and effective healthcare system, and we must have a diaspora that can effectively and more optimally contribute to this. Having anything less than this compromises our ability directly to have a stronger army, a more healthy demographically healthy population, a productive economy, higher morale, and an ability to channel some of the resources that are currently being wasted because of an inefficient healthcare system to other sectors, such as the military, such as our educational sector, and et cetera, et cetera. Is it highly ambitious? Maybe, but in the same period of 2020, where we talked about some of these shortcomings of diaspora engagement, something magical happened in healthcare, right? We had a vaccine that was developed in a fraction of the time that it normally takes a vaccine to be developed. And that was something that was up until 2020 perceived to be as something that's impossible. But we did achieve the impossible in healthcare. And I believe that by having a clear vision and strategy, we can do the same in transforming Armenia's healthcare system and in transforming the way the diaspora engages in healthcare in Armenia. I do want to acknowledge at least a partial list of people that have been very instrumental in putting together some of these thoughts, or helping me put together some of these thoughts. Certainly the American University of Armenia, the EIH program, are clear examples of effective diaspora engagement, and their model serves as inspiration for many of us. Dr. Armenian, Dr. Bedrosian, Kim Hekimian from Columbia University in New York has been someone that has been very, very active in raising these questions and thinking about solutions to our Armenia diaspora collaboration challenges, and has been instrumental in helping me form some of these this framework. Essentially, everyone and anyone that has done work in Armenia, whether it is in humanitarian relief to system strengthening, has contributed. And I want that message to be very clear at the end of this presentation. And we have a lot to be grateful for, and we have a lot to learn from every single one of these people and every single one of these efforts. This discussion is not about criticizing or being critical of any of this work. It's about finding the opportunities and the avenues to build upon this work to make it even more effective. But it is important to acknowledge that all of this work is very inspirational and has served as the critical foundation and the building block that we are now seeking to build upon. And so with that, I'll stop and maybe turn it back over to Asrik and see if we have time for discussion.
Thank you very much for such an interesting and very important presentation, Dr. Shekherdimian. Now we are open for questions. Actually, dear participants, you are welcome to either raise your hands or just jump in with your questions. Either way is acceptable. Yeah, please go ahead if you have any questions. I have a couple of questions. In the end, I will ask those. Let me see. Do you see any raised hands? Dr. Armenian, please go ahead.
Shant, it's very much in the very much a thought process that I know I have been following with you over the years, and there is a lot to be done. And in situations when there is a lot to be done, I'm looking at it from a diasporan perspective. What you do is, I think you alluded to that. I missed some of the earlier part of your presentation. What you do at that in that sort of circumstance, you say, what are your best assets and what is it that you can do best? And then you pick up from a whole list of a lot of priorities, the one where you can contribute best. And that's the sort of assessment that every diasporan association or organization or whoever wants to get engaged in Armenia has to start with. What is what are our strengths as an organization or as a person or whatever? And what is it that I can contribute in this huge list of things that Armenia needs in healthcare? So that is also a personal roadmap that each of the the diasporan organizations needs to do and focus on and develop that level of strength that is effective in the contribution. I think that's something where I would also start if I was a diasporan organization. Define what is it that what is the product that I can best bring to the table, and then engage in my negotiation with the ministry or whoever my partner is going to be.
Thanks, Dr. Armenian, for the comment. And I apologize, but I'm going to comment on your question with a question. Do you see risks in that approach, and how do you address the reality that if you were to ask a diasporan clinician, I would say that, well, I am a pediatric surgeon and I want to bring together all of my friends, and I have a big network, and we're going to raise a lot of funds, and we are going to establish a pediatric surgery center of excellence in Gyumri. And my other friend is a endocrinologist, and they are going to do exactly the same, except in endocrinology, except in Rapan, and et cetera, and et cetera, and et cetera. And so the question is, are there not risks in not having framework, structure, a roadmap that then helps guide some of these interests and aspirations, and says, it is great, Shant, that you're a pediatric surgeon and that you operate in UCLA on babies who are 500 grams and 600 grams, but the resources that you would need to do that in Armenia right now, we just don't have that right now. And if you are able to bring that resources in, we should probably be spending that money and that resources on some other issue that has a much bigger burden of disease or burden on our healthcare system. And so I agree we should be asking ourselves, but I also feel that there may be a risk of fragmenting us further, which makes us less efficient and effective in being a true partner in system strengthening. And so I would be curious to hear your comments about that.
Well, I think you took it from a different angle than where I was coming from. You came from a personal angle of the person, individual surgeon or individual practitioner wanting to contribute. I think the fragmentation is a very serious problem that came up with the within the Armenia diaspora from the early days, from the earthquake days. And everybody started developing their own NGOs or their own things, which have disappeared with time, hundreds of them. And however, the only people benefiting from that is the reputation that some of these people built by building their, their own NGOs. Unfortunately, we quote unquote shun away from traditional organizations that we have in the diaspora, particularly within the new generation, and try to forget about the role that these organizations have played and continue to play. And rather than going through the individual sort of initiated, as you called it, organization, individual initiated models, I would rather go through existing organizations and develop that counterpart of strengthening the existing organizations in the diaspora. Because we have shunned away from the existing organizations because of the traditional organizations, we are in this mess. The organizations themselves are in a mess, the traditional organizations, because they didn't get an influx of new blood or new input from the younger generation. So on the one side, you have got in the diaspora individuals who are doing their own thing. On the other side, you have organizations who do not have those individuals who can be the dynamic movers of these organizations. Whether it's ARS or AGBU or whatever, they are, they are all in the same boat. And that's a mess that was developed over time, and we let it go. Every time somebody came to Armenia, did 5 operations and went back, we publicized it in all the newspapers. Dr. So-and-so went ahead in Armenia. And so anyhow, it's not good to look at the past. For the future, an organizational approach, strengthening the organizational support that diaspora can give is one way to go in order to match what we're lacking also in Armenia from that sort of a roadmap. And my comments were very much organization rather than on that individual approach. And sometimes that organizational approach is not the best approach. Look at what the AMAA has done over the years. They have provided an umbrella for this specifically what we do not like to happen. In providing the surgeons or the internists or the nurses the ability to come to Armenia and say we're doing work in Armenia.
Right. And I think therein having the framework or the roadmap or the guidance for any of, I guess there's 2 ways of doing this, right? There's having a framework and guidance from the Ministry of Health or Armenia to help guide these organizations, or there is the need for these organizations to develop that themselves, right? But in the absence of that, if we have a lot of flurry of activity, but it is not addressing the areas of most need or most acute need, then all we have is that, which is a flurry of activity without much results. And so I guess maybe I would just supplement with what you're saying, which is everyone and every organization needs to sort of develop and focus on what they are good at. But all of that also needs to happen within some framework of priority setting and a bigger vision that is, in my mind at least, yet to be developed when it comes to diaspora engagement.
If I may, I think, thank you, Shant, for the interesting and thought-provoking presentation. I see some positive developments, to be honest, in the collaboration between diaspora and Armenia. And I guess if we publicize more the successful examples, such as how we arrange the AUA, EIH, and diaspora collaboration, EGORT's collaboration is another way of bringing the individuals and strengthening the existing system and capacity. The National Institute of Health is also working with individuals the National Institute of Health, like strengthening their current residency programs. I think that's also a bit revolutionary. We haven't seen this before. And that gives hope that we will eventually have better organized collaborations that lead to systems change. And so.
Thank you, Vatwijan. I thank you very, very much for bringing that up. I think perhaps in retrospect, I should have at least concluded, if not included more of these examples in the discussion and in the presentation. Agree 100% that we have success stories, that we have good models, and we need to talk about them more, publicize them more, and use them, hopefully provide them as sources of inspiration, or at least templates for improving all the rest of the work that we do. But I agree that the examples you've highlighted are absolutely success stories, many of them still in progress with their outcomes, the potential outcomes we have yet to see. So we're excited about all of those for sure.
Okay, thank you. Any other question from the participants? You're also welcome to write those questions in the chat, addressing to either to me, EIH, AUA EIH program, or to to all the participants. I do not see any other questions and raised hands. So let me ask my question, if I may. Frequently, when we try to go to proceed with the mentorship component in the EIH program, we frequently face the challenge of US physicians not being very familiar with the local context, and therefore it serves as one of the barriers, as a major barrier in terms of effective collaboration. In your opinion, what would be the best solution to overcome this barrier? I mean, you partially covered this throughout your presentation, but what we can do in order to ease all this process?
Yeah, so I guess conceptually there are two ways of looking at the issue. One is to expect, anticipate, hope, maybe somehow demand that if you are a diasporan and you are looking to get engaged, that really some of the imperative or the onus is on you to be familiar with these issues, to understand the landscape, the challenges, and then to plan your activities based on those. That may be, especially in healthcare, particularly in clinical medicine, for example, we don't, perhaps not a fair analogy, but we don't jump into doing a procedure or treating a patient that we don't have comfort or a good understanding of the disease processes, for example, or good training in that procedure before jumping into that procedure. In my mind, all of us should be holding ourselves up to a similar standard. And it's one thing to have the desire and the intent to quote unquote help or to contribute, but it's another thing to take the necessary steps to understand the problem and develop effective ways of being involved in or channeling that desire that we have to help. So I think part of it has to be ground up, so to say, or at the imperative, at the initiative of the individuals or the organizations. But to your point, and maybe also indirectly, you were asking the question or suggesting that we also should be doing a better job of outlining, highlighting, putting out there the challenges that Armenia's healthcare system faces, as well as the evidence-based ways of intervention or examples of successful engagement, such as what Dr. Bedrosian just mentioned, and in doing so, funneling the resources of the diaspora towards where we would want these efforts to go. So I think there's a role for both of these processes to be improved on. And I think, again, coming back to highlighting the success stories, it can contribute tremendously to this issue. I'm not sure if I've addressed your question specifically. My mind went another place, but hopefully, at least indirectly, discusses it.
Thank you very much. Just for the information of our audience, let me just inform you really briefly that the Entrepreneurs in Health program has a mentorship component, which aims in pairing you as physicians with our beneficiaries who are physicians, rural physicians, together and be involved in mentorship component, which includes in periodic meetings, online meetings, discussion of certain topics, discussion of difficult cases, and following up every time on a certain case, on a certain difficult case, and also discussing the strategies of strengthening the private practice of our beneficiaries. And also it involves practical exchange of experience whenever the mentor is in Armenia. Of course, we're trying to strengthen this component even more continuously. This is just for the information of the audience. I do not have any more questions at this point. Are there any other questions, comments? Oh, we have one question in the chat.
Mm-hmm.
Yes, okay, from Lilith Alvetisian. She thanks for the lecture, and the question is the following. Maybe a little bit wide, and it is the following. What are the lessons that we should learn from the last war and COVID situation in Armenia, and what are the small essential activities that the healthcare practitioners and professionals need to do or do better on a daily basis to improve the healthcare system and preparedness in the future?
Yeah, thanks, Lee, for the question. I apologize that I may not answer the question in a way that perhaps you intended it to be answered, but I think precisely what the point I was trying to make is that the lessons, at least learned for myself with regards to the pandemic and the war, is that the amount or the magnitude of what we do during these periods doesn't correlate with our outcomes and our impacts. And so the most important thing, the most important lesson that I think we should learn is that even in a pandemic, even in a crisis, even in an emergency situation, the preparedness for such situations, the inputs into strengthening the system so that it itself can cope with these situations is far, far more important than any hundreds of millions of dollars that we can collectively raise, and hundreds, if not thousands, of doctors and nurses that we can collectively send during those periods of emergencies or crisis. And so, so the real question is that, you know, if we as a diaspora want to engage and want to be there for these crises, can we change the way we think, and can we maybe, along with being prepared for the next crisis by having a list of doctors that can go to Armenia, can we think of ways of strengthening the system so that it is better able to cope with that situation in and of itself? Are we doing that right now? Are all the people that did go to Armenia, all the organizations, all the groups that collected the funds, are we now looking into a way of contributing to the healthcare system so that, for example, we have more effective transport of injured soldiers, or a transport mechanism? Are we contributing to the thought process of developing stockpiles of medications and antibiotics on a national level, so that if when the next pandemic happens, when the next event happens, we are more prepared as a nation to address those things? And so, and the answer is, by and large, no. That momentum has now faded away. It will likely come up again with the next acute issue. But if we can change the mindset, if we can change the way the diaspora engages, so that we are collectively thinking about strengthening the system, then that's the most important lesson that I think we can learn. To put it very bluntly or concisely, despite the huge peak in engagement, investment, activity over the past year that the diaspora inputted, we likely did not have a huge impact on ultimate results, ultimate healthcare outcomes. So identification and trying to pinpoint why that is the lesson to be learned from these, in my mind, with the exception of many of the things that Vartuiet said, with the exception of sort of our more strategic approach to being involved in oxygen capacity, oxygen production in Armenia as an example. But by and large, our methods remain the same, and our effectiveness, therefore, is inhibited.
Thank you. I think, and please correct me if I'm wrong, there are no more questions or comments, and the time is up, actually. So thank you very much for such an interesting presentation and then discussion. Please be reminded that we are going to organize scientific discussion series on a monthly basis within the framework of Entrepreneurs in Health program. And the next session is already scheduled and will be soon available on the event calendar. It is scheduled on June 24th by Dr. Vahe Kazanchan on the topic of healthcare quality assurance. Yes, this is all. Thank you very much. Whoever is interested is welcome to